Chair. Thanks, gentlelady. And I will begin the questioning and recognize myself 5 minutes for that purpose. Dr. Woodcock, in 2011, in a brief submitted to the Supreme Court in Pleva versus Mincing, FDA argued on the merits, and both the majority and dissenting opinions agreed that a generic manufacturer could not unilaterally change its labeling without violating the plain language of Hatch-Waxman. FDA has taken this position for more than 20 years over the course of various administrations. FDA argued in the 2011 brief that generics do, however, have a duty to provide adequate warnings, and that they discharge this duty by promptly contacting the agency about new safety information so that FDA can make an informed decision about any labeling changes the agency determines are warranted, without citing any evidence in the proposed rule or in the agency's response to the bicameral letter we sent in January. FDA now speculates that generic companies will stop meeting their post-market requirements under the law. Despite all their previous assertions to the contrary, and despite the fact that they took the exact opposite position in 2011, FDA is now claiming that the Hatch-Waxman Act does not in fact preclude a generic company from unilaterally changing their labeling to strengthen warnings, and that they should now be able to do so because the market has matured. Dr. Woodcock, the market has not matured all that much since 2011. What really prompted the FDA's decision to fundamentally change its position on these matters, and what role did plaintiffs' lawyers play in the process?
For FDA to look into this rule was partly by the court ruling that pointed out a disparity in the obligations between the generics and the innovator drugs. And in today's world, a world where the generics are more than 80% of all prescriptions dispensed to patients in this country, we feel the standards should be the same. The standards for manufacturing, the standards for safety and efficacy, the standards for overseeing safety, and the standards for reporting to FDA. So we wanted to have a level playing field, have the same standards, and correct this inconsistency.
Now, in February of 2013, while FDA was drafting this proposed rule, agency's officials met with several plaintiffs' lawyers, including at least one representative from the American Association for Justice, also known as the Association of Trial Lawyers of America. In fact, according to FDA's public calendar, one of the agency participants in this meeting was Daniel Siegelman from the Office of the Commissioner, who is himself a former prominent member of Trial Bar. Would you please provide the committee with the minutes from this February 2013 meeting?
We will get back to you with what we have.
Would you commit to working with the committee to provide any other communications between agency officials, including Mr. Siegelman and representatives of the American Association for Justice, relating to the proposed rule or other approaches that were considered?
Certainly.
Now, I'm going to read a statement from a separate brief submitted to the Supreme Court by Ranking Member Waxman and ask you to comment. Quote, "It is clear that a generic and a brand name label must be the same, and that a generic firm cannot unilaterally change its label. To permit individual generic drug labels to differ significantly from their brand name counterparts, particularly with respect to safety information, would thwart the sameness goal reflected in the Hatch-Waxman amendments." Dr. Woodcock, did the agency agree with this statement in 2011, and does the agency agree with this statement today?
All right. With certainly all due respect to Mr. Waxman, who is obviously the author of the legislation, I'd like to dispel the notion that the labels are the same now with respect to safety information. We have looked at this, and the It's not just the CBE0, but when we say do a class labeling, say for the NSAIDs, we put a box warning in, some major safety change is put into drug labels. There is a time frame that can be considerable under which the generics submit conforming labeling. And during that time frame, those labels are different. And in fact, I would submit to you from a practical point of view, as I administer the program, these drug labels are dynamic, and they change up to maybe 10 years, 15 years. I think our latest is 38 years after a drug's been on the market. We're still discovering safety information. That needs to get onto the label as quickly as possible. The generic copies may take quite a long time, months, perhaps a year or so, before they make conforming changes to their label. And then, of course, that takes much longer to get out there in circulation because the print nature of the package insert. So while in principle they are the same, because of the dynamic nature, they are not literally and exactly the same right now. And the proposed rule, if it were enacted, would actually narrow down that time, that disparity, that temporary difference. And after FDA would approve, maybe we'd not put the safety label in, or maybe we would decide that a safety update goes in a drug label, then all the manufacturers of that drug would have to change, and the generics would have 30 days in which to do that.
Chair, thanks, gentlelady. Now